Hello, my name is James Dungan-Seaver. I'm the IT manager at the Hamm Clinic here in St. Paul, Minnesota. The Hamm Clinic went live with the practice management of our first EHR in November of 2010, and then in April we went live with the clinical side of that same EHR. We used that system for about 2 years, during which time we decided to replace it, and so we went live with the second replacement EHR in October of 2013. Hamm Clinic, right now we don't use Health Information Exchange, although our EHR does support it, and we are working to develop the policies and the procedures to make a successful information exchange part of our normal practice. I heard about Stratos Health through another healthcare organization, a friend of mine that worked there. I had just been hired by Hamm Clinic to be the IT manager, and it was my first position in healthcare. My responsibility was to get the clinic ready for EHR and then to lead the process of selection and implementation. And I had no idea where to begin or where to start. I heard about Stratis, I heard about the toolkit. I would go out to the website, and there was this wonderful array of everything that I needed, whether it's PowerPoint, webinars, documents, communication pieces to provide to my staff or to my committee members that were helping with the EHR selection, step-by-step instructions on what needs to happen. So many tools were out there, and we didn't need all of the tools, but we did need some of them, and every tool that we needed we found there on the toolkit. The toolkit provided the basis that we needed to get through in a stepwise fashion through this whole process. We used it as our roadmap for everything that we were doing. We didn't need to cover everything that was listed in the toolkit specifically, or we felt like we would be able to cover it adequately several steps at a time. But always when we had completed some major portion of the process and we didn't know what to do next, we would return to our roadmap, to the toolkit, to find out what was next, what is the recommended way by Stratis in how to proceed. And that was extremely helpful because it kept the process moving along in a timely way, which is critical to being successful. Hamm Clinic used the first EHR for about a year, year and a half, and then we decided that we needed to replace it for various reasons. We tried hard to resolve them, but we were unable to with the vendor. So we went back to the research that we had from our first time around using the Stratos Toolkit, and we believed in our results so much and were very confident in what was there. That's what we relied on for our second EHR selection as well. When we were using the toolkit, it addressed all of the issues that we were concerned about. You know, what kind of technology, what kind of questions would we ask the vendors, what is the right flow to take through the project. But it also brought to light different things that we hadn't considered, such as the politics and the dynamics within an organization that occur when you have a big project going on, such as EHR. There's a lot of money involved, and there are politics between clinical staff, administrative staff, management, and that's all there. It's all part of a healthy organization, and it's okay. But this toolkit helped provide some answers to these questions like that. For instance, the three tips that really come to my mind as most helpful was that the electronic health record is not just an IT thing. It is something that belongs to the whole clinic, and specifically to the clinical side for the health record, and then to the billing and accounting side for the practice management. It's not just an IT thing. IT makes it work, but those two parts of the organization really use it. And then the other tip that was most helpful had to do with voting. When it came time for the EHR committee to vote on which solution to go with, the recommendation was to not have the IT guy or the CEO or the highest ranking management person on the team vote. And that by not voting, it removes the politics from the situation. The vote becomes more about the clinical people and the billing people who actually use it making the decision, and that was critical for us. and that finally that the vote has to be unanimous. You can't have a majority situation where people who vote no, and then let's say like Hamm Clinic, you would decide to replace the system, so then there is some disparity there. And so we did a unanimous vote with myself and the Chief Operating Officer not voting, and that in retrospect that was a very good decision and very good advice. I recommend not delaying as much as possible. Get ahead of the situation, get ahead of the curve. The change is coming, and so take charge of it and drive it yourself, and drive it with people from inside your organization as opposed to people outside your organization. With the advice for adoption, expect to be surprised at how your assumptions were wrong in whatever you're doing with this, because as you get deeper into the process, you will learn that you have some very big assumptions that were off the mark. It's almost inevitable. And I recommend that you do the process yourself. Don't follow somebody else's lead from some other organization. Don't just call in 3 EHRs, have them do a demonstration and then choose one. Take charge of the process yourself. The more you learn about EHRs, the more you learn about how one particular EHR will suit your organization better. That was probably our biggest learning experience, and that came about by using the Stratos Toolkit. I would recommend using the toolkit and make your own way with it. It's very reliable. It's very interrelated information that's extensive, and there's nothing like it out there. The Hamm Clinic's EHR work, we started back in about 2007. We formed our committee in 2009. We worked through and went live in November of 2010, and then in April of 2011 with our first EHR. It was a lot of work to get to that point of going live using the Stratos Toolkit. And we found that when we went live, the work didn't really stop there. This was moving over from paper to an electronic record was a lot of extra effort as well. We continued on through that EHR, and then we went with a replacement system, and so it's just the work continued on, hard work all the time. But we found that in the end, it's worth it. The client care is improved by having so much information on hand, on the computer, at the point of service, and there's no going back to a paper record.